Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
Physiotherapy in mother-child care. If you think on physiotherapy and the mother and the child, we can say there are 3 times which we can identify where physiotherapy can be from help to mother and child. One time is the prenatal time, the time before birth, the pregnancy, the time during pregnancy. There we offer physiotherapy. Mainly here in the hospital for the women who come to wait for delivery. We give them antenatal training, exercise and explanation. Some we see maybe on the health center, we can do the same activity. Some we just see in ANC control when they are coming and we give some instructions to them. They are not really here, they are not following the exercise classes, they just come sometimes and they can have some explanations. We have the perinatal time, this time around birth, the day before, after, immediately after the exercises, when mother is still here in the hospital with the newborn baby and they recover, to reorganize themselves for going home. So this is the perinatal physiotherapy. And then in the postnatal time, that would be after birth, or we could say it's in the under 5 time. So when the child starts to grow, the mother is recovering, settled down in her all-day situation at home, and we look maybe even at a problem a child can have, so we can assist the mother to help this child. So we will look now briefly at these 3 times where physiotherapy helps the mother and the child. So it's during pregnancy, around birth, and then the first few years when the child is small. So there is a particular attention to mother and child. What is the same in all these 3 times? Mother and child is all the time a union. When the mother is pregnant, there is already a relationship to the child in the belly. During birth, it's a very intensive moment for mother and child. After, in these first 5 years, when we're treating children, we are always involving the mother. We have seen these 2 Klepford children. You cannot treat these children without the mother. It's always a union. So physiotherapist is looking always at mother and child, not only the child or only the mother. It's mother and child. It's a union. So we respect that union, if it is in the prenatal time, the perinatal time, or in the time after birth, in the first few years. So let's think about mother and child. It's one. We are always involving the mother. No child without his mother. So if we look now at the first topic, it's the antenatal time, the time before birth. It's a wonderful time. And mother comes for consultation, for being observed and having some first indication how to go on with this pregnancy. More the medical part, obstetric, the nurses screening them and looking if it is maybe a birth and risk or not, and so on, these things. And in this time, physiotherapy has a program for the mothers. And that program includes for me 3 aspects. Physiotherapy can sustain that. And if Teresa can write it on the blackboard, let's write a triangle on your piece of paper. A triangle made of well-being, of general fitness, and relationship to the growing child. These are 3 key factors in pregnancy. If we want to help the mother to arrive at birth in a healthy, happy way, we shall support these 3 factors. During pregnancy, let's help the mother, to sustain, to develop these three factors: well-being, general fitness, and relationship to the growing child. If we nourish these three, if we sustain these three factors, pregnancy will go easier, will go better, and birth can be faced more easily. Now, what do I understand by well-being? What do we think by well-being? That means that the mother is sufficiently happy. Of course, we have sometimes sad days, or we have problems in our life. This is normal. We cannot expect that life is without trouble, or that life is only happy. No, sometimes we have pain, we are in grief, we have difficulties. It's normal. But that they were sufficiently happy, that there is joy in the heart of the mother. Well-being means that she's physically well, that she's not sick, that she's not suffering about something. Well-being means that she's well nourished, that she has a balanced diet. Well-being is that she is active, that she is participating on all the work, on the activity and the relationship, on family and community life. This is part of well-being too. Well-being of the mother means as well that she feels cared of, that the family is caring for her, the husband is caring for her, or doing what he's supposed to do for the family, that she feels care of. This is all part of well-being. So I created a model of generating well-being. So if I ask myself, what do I need to feel well? What can I do that I feel fine in my life? So I have this 5-point model. And now we will write it at the screen, at the blackboard. You can do like number 5 on a cube, on Würfelsfifi. It's like a quadrat. You have 4 points, and in the middle there is another one. Okay? Yeah. So on the left, high up on the left, you have light, fresh air, and movement. Also, das ist wie die 5 Punkte vom Würfel, gell? Oben links ist light, and movement. On the right, you have relaxation and sleep. In the middle, you have balanced diet. Low down on the left, you have positive group experience. And on the lower part on the right, you have nourishing relationship. So you have these 5 aspects. Please write them down. In that way, Teresa is writing them down. Please note these 5 points. These are 5 points, 5 topics or themes, I can say. If we develop them in our all-day life, they give us well-being, psychologically and socially and physically. Our physical health depends on that. So light, air and movement, that's easy to understand. Move outside. Every day move outside. Being on the move outside. We need light physically for our hormones, for our sleep, for our for the whole blood system. We need these type of hormones which are stimulated by light, daily light. So don't be all the time in the house, outside. Movement and fresh air. Here for people in rural areas it's not such a problem because we are all the time outside. People in the cities, sometimes they are too much inside. They are indoor people. So to those one I have to say outside, move, and the fresh air, move, outside. This is something important. Then you see relaxation and sleep. It's important to have a regular, good sleep. That means to have warm enough, you have your blankets, you are being comfortable during the night, not being disturbed during the night, to have a good sleep. When we sleep regularly and of good quality, our health is very much sustained. If we are fragile in our health, it's so important that we sleep regularly and that we have a good sleep. Sometimes, maybe the neighbor is snoring and the person is waking up all the time, so the sleep is disturbed. Maybe it's not a problem if you're fit and healthy, but maybe when you're in a particular stage of your health, it will become a problem. So a good sleep, a good and regular sleep is so important for health. Whatever we have, if it is TB, if it is HIV, if you have a minor disease, if you are in pregnancy, important to have a regular and good healthy sleep. Here in the mountains not a problem, but in modern life in the cities, people tend to have the TV in the sleeping room, and then they go to bed and they watch TV and they start to sleep. The TV is going on. So that sound from the TV is disturbing the sleep. Even I don't hear it, but the organism can still hear it. And when the initial phase of sleeping is disturbed by sound, the whole sleep during the night is disturbed. And if we have a disturbed sleep, after a few weeks, it will start to disturb our physical health. Therefore, it's so important, in a special, particular health situation, we have to have a good sleep, restore good sleep. Some people don't sleep enough because they do many things at night. Maybe they are going to the bar to drink. Maybe they are sitting on the computer. Maybe they are watching TV. So by the end of the day, they slept too less. And if we have not enough sleeping hours, it's disturbing our health. It's not so the problem up here. Because what can you do when night is coming? You can sit there in the hut with the candle and there you go. If you have electricity, maybe you are already on the TV. So it's important that we have good quality sleep and enough long sleep. For well-being, we need a good sleep. Now, at the balanced diet, I think I don't have to tell you anything. You know much more than me what is important to have a balanced diet and what it means having a balanced diet. It's important to have it, and during pregnancy it's so important that mothers have really a good and balanced diet regularly. Then positive group experience, feeling part of a group, that means not feeling lonely, being part of the group, being active in this group, being recognized in that group. This is something which is boosting our healing power, our health power. If we feel lonely, if I feel don't cared of my family or my friends or people, if I don't feel cared of, this is making weak our health. It's so important having friends, having good relationship in the family, being part of that village where we are in, being part of a group, feeling part of a group, being recognized in a group is important for our physical, psychological and social health. Therefore, going out, meeting friends, being together in the women's group and having a good time in the family is very important for health, for all situations in health. One after the other is going here. Now the last point, nourishing relationship. having a good relationship, the good friend or with husband or wife or maybe with the mother, with the father or just a good neighbor, having a good relationship where we can talk as we are, where somebody's listening to me, where I can be that one who is listening to the other, where we help each other, where we are just easy going together. I can trust, I can ask her whatever I want, she will help me. She knows that whenever she is in need, she can ask me, I will help her. I will understand her weakness, she will understand my weakness, and she will challenge me if I may be lazy. I will challenge her if she's lazy. This type of relationship, okay? A good friendship. If it is within the family, in the couple, or with the neighbor, with the friends, you can have nourishing relationships in many ways. And having nourishing relationships, we see, helps to be healthy, and well-being comes. So if we don't have nourishing relationships, something important is missing. It's not enough that we have food, water, heat, and a good bed and a good house. It's not enough. We need for our soul nourishing relationships, and we need for our social life positive group experience. So these 5 factors, it's a way of primary healthcare, helps to build up well-being. And we see if the pregnant mother feels well, and if the people who are around her help her to feel well, pregnancy goes much better. The health of the growing child is better. These mothers, when they feel fine during pregnancy, everything goes better. So therefore it's important that we sustain the well-being of a mother where it is possible. Sometimes we know it's not possible. When they are very poor and they have difficulties at home and primary things are missing. So sometimes pregnancy is very, very tough to that woman. Can you follow me?
Yes.
Okay. Now, at the aspect of body fitness, general fitness, I think there is not a lot to say. If people are active, Bomme are active, they are exercising, they're doing respiration exercise the whole body, they're just moving, they help themselves, they help to the child. When mothers become passive, it's not healthy for them, it's not healthy for the child. So being active, going on, doing the exercises, going to work, it's healthy. Everything which creates movement and activity, it really helps them. We have some exception. If you have very early contraction, so they have to stop to exercise too much. So doctor or the nurse will say, lie down, just be quiet that the baby is not born too early, because premature birth is always a problem. So this is one of the exception. Or if the mother has very high blood pressure during pregnancy, so we have to be careful with movement. She shall move, but not heavily, not as you did this morning. She shall do continuously gentle movements, but not too much. So we wouldn't force it too much. Or if we had a mother who had already some abortion, spontaneous abortion, so be careful. Don't exaggerate with movement. She shall move, but not too much. So there are some exceptions. But if it is a healthy, normal situation, mothers shall move. They shall go to work. They shall be active. They shall play the ball. They shall enjoy being fit in their body. It helps to pregnancy. Being passive, being lazy is not helpful for anybody. That's fine. Now, the third aspect of that angle is relationship with the growing child. What do you think about that? Is it natural to have a relationship with the child in the belly? Is it possible to have a relationship with the child in the belly? Yes. How can you say, how is that relationship? How can the mother live and nourish this relationship with the child in the wound? How is she related to the child? When does she feels it, etc.? Can you talk a bit about that? What do we understand when we say mother has a good relationship to the child? What does it mean? How is that?
The mother will feel the kicking inside the baby.
feel the movements, huh?
Yes.
So she feels it's lively, it's there, she gets used to it. There's some type of physical contact with it. Yes. Does mother enjoy that? Haholo. Why did you enjoy that so much? You had children. What was the beautiful on it? She says, yes, haholo, I enjoyed it very much. So I'm asking further, what was your joy? Why gave it to you so much joy?
Because the child is alive.
Yes, we know the child is alive. We know it's there. It's lively. Happy. What else made you that joy?
You're going to be a parent.
You're going?
You're going to be a parent and you're going to have something to be happy about.
Yes.
You're eager to see it alive.
Yes. You have something which you're waiting for, you're looking for, and it gives you a sense of responsibility in a positive way. You know why you are here. That's something of it's beautiful when a couple becomes parents. They immediately have another responsibility towards life because they get more sense why we are here. We are here because a child is coming. So that's that part, yes. Happy? Why gives it such a joy to feel that kicking in your belly? What was your joy when you felt the child in your belly? Sorry, I didn't understand. They were?
Position.
The position. You could feel the position. So you got even an idea how the baby is in yourself, how it is made. Here is the head, here is the pelvis or the legs and so on. So you already had an idea how it is made of the child. Every mother is dreaming of the child. And then when she starts to feel, oh, it's like this, it comes closer to that dream. We are curious to see the child, isn't it? Yes. The fathers as well. But maybe the mothers even more. Yes. The contact to the child, that relationship is more intensive between mother and child, of course. So we said that relationship to the child, how can the mother encourage this relationship? What can you do to be in contact with your child?
I buy clothes.
You buy clothes? So you prepare already to receive her or him?
I attend ANC.
You attend ANC, you take care for yourself because you take care for you and the child. You go regularly there. You do it not only for you, you do it as well for your child. Yes. Happy?
Talking to the child.
Talking to the child. Doesn't make sense to talk to the child.
It doesn't make sense. I don't talk to the child. It doesn't make sense.
You are completely wrong.
Why?
It makes sense.
No.
We men can say it doesn't make sense because we are ignorant. And I include myself in that too. Because we men, we don't know that. We are out of that business. Bomme, they can tell you. They talk to the child, and child is calming down. Maybe they can feel it's agitated. Children sometimes in the belly are stressed. So they are somehow agitated. Mother is talking to them, maybe singing a bit, and it feels the child calms down. Is that true or not? It's true. You see, we men, we don't know. We just have to listen to women.
Let's not listen to what you can.
You are young. You should open up your ear. Your wife, she will tell you. So when mother is talking to the child maybe is not understanding the words, but is understanding the music of the words, the way mother is talking. That means the soul of the mother is talking to the child, to the soul of the child, through the music of words. This is the language. Mother understands that absolutely. Everybody understands that. Because they feel it. There is a connection between the souls of the mother and the child. So while talking to the child, comforting him, maybe the child is agitated, you just help him to relax, to be confident, to trust. You talk to the child, understands it. Somehow, it's not understanding the words itself, but the way of talking. The child can feel. Remember, the child can feel the vibration of the voice of the mother very early. The child, after 2 weeks, can perceive stress hormones of the mother. So when the mother is calm, that 2 weeks into is already feeling that there is no stress hormone. And when the mother is agitated, when she is stressed, it feels chemically there is stress hormone. Imagine. With 2-3 months, every word of the mother, the child feels on the skin as a vibration. It's like a massage. The first sound experience is vibration. Therefore, touching is so important later. And with 5 months, the child is listening with the ear. From 5 months on, child starts to listen with the ear and can hear the music of the words. And maybe with 6, but at least with 7 months, child remembers voices, starts to hear voices from outside, the father's voice. When the child is born, on the first day, that child recognizes already the mother by the voice, because she has remembered it. The father after the second day. If the father is around the mother during pregnancy, the child after 1 day being here knows it's him. Because the child could hear that voice already in the belly, but the father has to be there, and the father has to talk. Otherwise, the baby is not listening to the father. But if the father is there and you're talking and chatting, and maybe the father, and we will talk about that relationship of the father to the child. If the father talks, the child hears that voice. She's not so sure, but after a day, she knows, yes, it was this voice which I was hearing. And she will relate to that father. She will relate more as to another male's voice. Isn't that fantastic? So the child is very much alive in the belly, and the child is relating to us, also to Bomme, by kicking, by moving and reacting. The mother, when she is calming down the child, or when she said, no, let's quiet, now we have to go. And so when the mother is animating the child in one way or the other understands it. Therefore, that relation is so important. And interesting is, when the mother is nourishing this relationship to the child, during birth, everything goes much more spontaneous. So if we learn how to give delivery and we teach how to relax and to push, these things are all important. But what we can see now, and I was talking now to an obstetric which is very keen of all these things, she told me, if the mother has a good relationship to the child, if she feels the child, naturally birth is going much easier. So don't learn only how to press, how to breathe, how to relax. Learn as well to be in contact with the child. So naturally things start to come by itself. I just would like to do a comparison now. Maybe it's a little bit strong, but let's look at nature. If you have a cat, that cat is pregnant, then it makes the little cats. Have you seen that, how it is doing it? It's marvelous. Just giving birth one after the other, she's opening the bag and she's leaking it and preparing the child. Nobody told that cat how to do. A female cat after 1 year has the little baby sucker. She hasn't seen how to do it from another cat. The mother cat was not teaching her to do it. She is doing perfectly. What is that? This is nature. We can see it in all the animals. It's true, sometimes animals have difficulties as well in delivery. Maybe you have seen it with cows or so. Sometimes it can happen. Of course, this is nature. But there is a natural knowledge in the organism how to give birth. And we can trust in that. But that still means it's okay, we prepare for birth. But if we have a good relationship to the child, it seems that these natural resources are activated. So therefore, having a relationship to the child is psychologically important for the mother and for the child, and is a good preparation for birth. If you are in contact with your child, things go much easier, and mother will feel much better if she has to push or she has not to push, and when to push and how to push these things. You just feel because you are in touch with the child. Now, the important question, is it possible that father has a relationship with the child during pregnancy? Is some of you is a father?
It's disposable.
Yes, what can you say, Bondate? The fathers. How can you have a relationship with the child?
When I woke up, I was only in high class. When he's massaging on my abdomen.
So,
actually,
when the father takes care of the mother, and maybe massaging the back, she has a bit back pain, or she's just massaging the belly, having the hand of the belly, that would be possible of physical contact, sharing that experience. Can you agree, Bomme? Yes. Other way that the father can have a relationship to the unborn child.
I won't know. I don't have any relationship.
Before, Bomme spontaneously said, when I go to ANC clinic, so if I go to the checkup and learn what to do, I do good for me and for my child. There is something similar when the husband is sustaining the mother in that, or when the husband is going to work to bring money home, that the family is not in trouble, that there is enough food, that they can heat the house, that things are going well, that there are no problems at home. This is the way you relate to the child. If you create an environment at home where your wife can be well and safe, things are going well, she feels cared of, that means you are already in touch with the unborn child. You're creating a reality which is welcoming that child. This is a contact with the child.
And also when I'm sick, he has to take care of me.
Yes. When the father of the child is taking care of me, so she feels taken care, she feels well in their pregnancy, even she's sick, she feels cared of. This is important for the health of the child. Every stress of the mother is a stress of the child. So therefore, if the husband is taking care for the family, for the mother, etc., he's already relating to that child. He can talk to that child too. It seems somehow when we say that. But why not singing a song to the child in the evening when you're going to the bed? You can do that. The child is listening it.
To the abdomen.
Yes.
Not to the abdomen. To your wife with the child in the belly. A pregnant wife is not a big abdomen.
And sing.
It's a you. Yes. You just sit there and you sing. You do something. It sounds strange, I know. Anyway, this is me. Massaging the mother, taking care for the family. All that helps to feel well the pregnant mother, and well-being of the pregnant mother, a good relationship with the child is a very good preparation for birth. Isn't that beautiful? And it doesn't cost us anything. It doesn't cost us anything. We just have to change mind.
Sing to the abdomen.
We just have to change the mind a little bit. And more as women, we Bondate have to change mind a little bit. We have to understand that the well-being of our wife depends as well from us. Okay, women are not functioning, women are being. So we are together, relationship is nourishing. So therefore we can learn. I know this is maybe very progressive if you look maybe a shepherd and he lives in a traditional lifestyle. If you tell him sing for your wife, he will look at me. Anyway, but not everybody is like this. Anyway, we have different styles of life and that's fine. But we have to know, if we want to have well-being of the mother, she has to have physical fitness and she has to have a good relationship with the child, and that can be sustained very much by the father. And has to be sustained by the father. It's his duty. So he has to do what he's supposed to do as a father. There's no way to hide away from this responsibility. And it's something beautiful to do that, and everything goes easier when we do that. That's fine. So this is, in prenatal time, maybe the most important thing that we have to sustain. By teaching exercises, we give them in the exercise class general fitness exercise. You can do even exercise like this. We give them relaxation exercises, how to relax. We give them breathing exercise, how to control breathing. And we talk about pressings as well. But every class, and maybe this is an introduction now in the exercise we do here in antenatal class, in every class, just create a moment where you go in contact with the child. Maybe when you start the relaxation exercise, just put a hand on your belly. How are you today? How is your child today? How does your child doing while you are doing exercise? Just do something, some massaging on the belly, holding many, or just maybe moving a little bit. We will show you when we do practicals. To have a gentle contact with the child. So every exercise class shall have these exercises for fitness, for relaxation, for breath control, for compression, the pushings, and contact with the child. Just include it, so mom may get in contact with that and they get used to that, to have it. And if you do some singing in the group, remember the children will hear it. So a nice song on the beginning, a nice song on the end becomes a ritual for the unborn baby. It's something very healthy. When mother is singing that song later, the child will remember. You can relax a child when you sing a song which the mother was singing in during pregnancy. So important is that singing, and the child will remember. And that's the same for the father. So this is in antenatal clinic. Now let's look at the watch for a moment. Can you follow me as far? These is content of antenatal physiotherapy. Physiotherapy in the antenatal time. There are some clinical aspects. Sometimes mother have back pain, or sciatic nerve pain, or they have numbness, pins and needles in the hand. It comes because it's swollen here at the carpal tunnel. Sometimes they just have a little bit difficulty with obstipation. So there we do the regular physiotherapy. If they have back pain, we give them massage and exercise. If they have sciatic nerve, we give them a proper relaxation position and back treatment. If they have pins and needle in the arms, we give them the lymph drainage. It's some special massage here, which is taking off that liquid which is pressing on the nerve. Do things like this. If they have problems with constipation, we give them more to drink, and we teach them the self-massage on the belly. Maybe it will help them. If they have other medical problems, high blood pressure, we refer them to the nurse and to the doctor, that they are followed up in ANC clinic. So this type of physiotherapy we all know. Now, during birth, we said most important, we prepare the mother during antenatal time with good well-being, with body fitness, and with relationship to the time. As soon birth is over and she comes in the PNC part of the hospital, we start to teach them the PNC exercises. So these are exercises to rebuild activity of the abdominal muscle, of the pelvic floor muscle, of posture, deep breathing, and even loosening a bit the shoulder, because mother starts to nourish the child, so sometimes they are a little bit flexed, so we give them exercises for the back and for the shoulder, and very important, as I said, the pelvic floor exercises, abdominal exercises. In the postnatal time, you have sometimes the woman with cesarean section, so they have the post-operative physiotherapy and then the same PNC exercises. And if they had symphysiotomy, if they had to be cut on the symphysis pubis, so they get some more exercises to get stable at the pelvis. And on the beginning we give them walking exercises and the tight belt around the pelvis. They can even wear tight jeans just to catch together the pelvis, to give a bit stability of the symphysis pubis. And we tell them to avoid and enlarge too much the legs, so they shouldn't horse ride for quite a while, 2-3 months. They shouldn't horse ride, because by horse riding, opening the legs, you're pulling on that symphysis. So they shouldn't horse ride, or if they ride, to have the legs on one side. You know, as the Queen of England is riding the horse. You have seen that. So she's putting the legs on the side, not on the horse. So with both, if she has to go by horse, she has to ride like this, not with the open seat. So in special exercises and the belt, this is the program for the symphysiotomy woman, but rarely it will be done. You don't see it often. It can be life-saving for mother and child to do that, but luckily they do it much more rarely these days. So this is the program. We have to animate them, we have to give them the exercises, and then they do them at home. In the time between 0 and 5 years, the first years, what we can see is that mother brings the baby for some problem, clubfoot, other foot anomalies, sometimes hip problem, hip is not moving properly, it has to be looked by the orthopedic surgeon. If there is an anomaly of the hip, if it had to be operated or not, maybe they get some bandaging, we have to do this bandaging. Sometimes they have a problem on the back, open back, so as well, orthopedic surgeon has to look at it, if it has to be closed. Maybe the child has some problems due to birth, maybe paralysis of the arm. So we have to work on that arm a little bit, this arm paralysis. Maybe the child is a little bit deformed on the head. Sometimes you feel somehow the head is mal-shaped. If it is not too much, if it is not really, as we call, a monster head, sometimes there are some anomalies. The head is very big, or sometimes there is a third eye, things like this. I'm not talking about that. This is very rarely. But sometimes just the head is somehow mal-shaped. There we can teach head shaping. We were talking about foot shaping. You can do head shaping. These bones are quite soft, that you can move them. So sometimes the head, due to the position in the womb, or due to birth, but mainly due to the position in the womb, is somehow mal-shaped. So you can do a head shaping, you just gently move it every day, slightly, and you can reshape the head. It's possible in the first few months. So you can teach the mother how to reshape that head, just moving it in a harmonious position. If it's a simple deformity of the head, you can do that by head shaping. It's possible. So we have children like this, or we have all these children, maybe they have problems with the bronchi, there's just some infection. So we teach the mother how to do the inhalation and how to do the gentle percussion and the position that we can do the drainage. Maybe we have the children, they are disabled, they have some cerebral palsy, they are not developing properly, so they have to have a long-term physiotherapy and to follow up, and we teach the mother. We call them to the hospital for short-term teaching, rehabilitation. Maybe you have paraplegic children. So if we have disabled children, we start all that physiotherapy to help to develop the children. We will organize the pediatric who is checking the children and defining that problem, and we have to look what the child will need in the coming future. We have to follow the mothers in these first years with the children when they are disabled, because it's always too much for the mother. No mother is prepared to have a disabled child. We have to learn to be prepared for it. So physiotherapy will help them, and they come regularly to physiotherapy. This is an important part of under 5 physiotherapy, to follow up the disabled children with the mother, to help them and organize what is to organize to them. Sometimes you will have children, they have sensory problems, maybe they are blind or have deaf, so very early they have to be stimulated. Children who cannot see well, in the first year you can help to develop the eyes by certain stimulation. The same by the ear. We teach the mother that she shall sing and talk a lot with the child, having it on the body, so that the child gets an idea about talking just due to vibration. It will help later to read the lips. When the child has already an experience, a physical experience by feeling voice, it will be able, when it's big, to read the lips by the person, much easier. So there are many things how to teach a deaf child from the early time, few months. The same for a visually impaired child. There are 2 very nice books, How to Teach a Blind Child, How to Teach a Deaf Child. It's from the same edition as Disabled Village Children. 2 very nice books. So on the very early stages we can help the mother, and then we have to organize the contact with the League for the Visually Impaired, where they are helped, and then it's sure that they are going to the school for the blinds. Blind children, deaf children have to go to special school. There is no sense to have them in the village for the school, because they won't learn what they can learn. These 2 groups of disabled children, it's better when they go to the special schools. So We have this type of children. Sometimes you have a child which cannot speak properly. It has to be assessed with a pediatric, and right from early time we do speech and vocal and melodic training exercises with mother and child, that they get used to sound and to the vibration of sound, and then we have to find out why it is not speaking, and maybe we can develop the early skills for speaking. Later it has to go to a special trainer, speech trainer, the logopedist, which we don't have in rural areas. They are down at Maseru. So therefore, the beginning we have to do with them. It's written a lot in Disabled Village Children about that. So this is only an overview about topics in physiotherapy in the under 5-year time. So there are many types of physiotherapy we are involving. So this is an overview, as I said, to mother-child physiotherapy in the time before birth, very important time, immediately after birth, perinatal time, and then in the first 5 years, that early time of the childhood. And what we learned, we address all the time mother and child as one thing united. Where father can be involved, is always welcome. Do we have question to that topic?
Someone SMS to me yesterday, he said child is 1 year and 5 months and is not yet standing or walking. So is it still normal or still?
A child with 1 year and 5 months is not walking,
Standing, yes.
not standing.
Yes.
So she's just crawling,
Yes,
maybe sitting,
yes,
maybe. So let's say if a child doesn't walk with 1 year and 5 months, if that child has nothing abnormal, it's just he's talking, he's eating, he's using the hands, he's looking around, he's behaving normal, it's just not walking, don't worry. It can be okay with 1 year and 6 months it starts to walk. I myself, I walked with 18 months. My mother was somehow preoccupied. She went to the doctor and he was looking at me. I said, no, he's perfectly healthy, just a little bit lazy, said the doctor. What she did, I have 2 sisters and 2 brothers, and we were in countryside, and we had a nice piece of garden in front of the house. So my siblings, they were playing outside. So she was just putting me in the grass. My sister and brothers, they were playing there. She was putting there. And within 2-3 days I was walking. She just put me there, so I was stimulated to play with my brothers and sisters, and I started to walk. So there was a reason that I was walking. I was a bit lazy. And as I didn't move a lot, she just left me there in the bed. So I had no reason to move a lot because I was in the bed. And she thought, I don't need to move because I'm not moved because I was in the bed. So she said, okay, let's change the business here. She put me outside in the garden. My siblings were joking and playing outside. I was stimulated. I stood up and started to walk. I was crawling, but I wasn't walking. So there was a need to walk, and I started to walk. So therefore, until 1 year and 6 months, if the child is normal but it doesn't walk, don't worry about it. It's not too late. Now let's have a careful look. Is the child really normal? Does it crawl? If it is not crawling really, if it is crawling like a frog, to 2 legs behind together, you understand how I mean? Like a frog, that's jumping of a frog or of a rabbit. If it does like this is an abnormal pattern with 1 year and 5 months. It should crawl normally. If it doesn't crawl normally, if it cannot sit really, or if it's always hanging a bit around, coming forward, it has not really a good tone and posture in sitting, that's not normal with 1 year and 5 months. If it's not using really the hands, if it's not taking some food, bringing it to them, if it's not taking the toy, bringing it to the mouth, or playing in a simple way, that would be abnormal. That would say, have a look at the child. That development probably is a bit retarded. if it is not talking simple words, me, ntate, things like this, it should say with 1 year and 5 months. If it is not relating to the people, it's something strange. So we have to check her for her development. So therefore you can SMS back. All the other things, are they normal? Or is there something special on that child? And then we will see immediately. If everything is okay, don't worry, give the child a chance, put it on the floor. Sometimes children are a bit passive by itself, and then maybe she has it a lot on the back, and she doesn't put it really on the floor. Children start to move when they're on the floor, when they can move. So maybe she should put it a bit more on the floor, but if there is another thing not normal, it should be checked.
Okay, that's more.
Yeah,
Thank you.
very good. Another question? The checkup of children does the pediatric doctor. The disabled children, they can be evaluated by people who work with disabled children. When we are here in December, January, we are evaluating children, so they can be sent as well here, and we do a checkup, we can write some lines for them. That's okay. But in Maseru there are special peoples as well, and there are physiotherapists at Queen 2, and there are special pediatrics who can do that. But people in the mountain, they can send them here and we can look at them, or when I go to Sebocho, to Mochotlong, we can visit them there. Okay. You have the chief in charge with you here. Okay, so let's close that and we go for tea time.